Hello and welcome. I'm Dr. Rani Radhakrishnan, a pathologist by training and a hematologist by choice. In this session, I'm going to talk to you about the scatter plots, the cytograms, and the histograms that are today forming a part of every cell counter that we have in the hematology lab. Unless we understand what these convey, we've not fully understood our cell counters, and therefore we will not be in a position to really interpret what the information that the cell counter gives. This is a series which we shall call the scatter matters, because I truly believe that the scatter of cells that we see on cell counters tell us a story that is beyond the numbers that are provided for in the report by the cell counter, or for that matter, in the reports that we give out to our patients as a complete blood count report. The scatter plots, the cytograms, and the histograms are the various pictures that tell us a story. And as we all know, a picture speaks more than 1,000, and in our case, numbers. So let's begin our journey. Let's start learning about these pictures that form a part of cell counters. And as we get to understand them and as we get to enjoy them, we shall also make it a point to use them to interpret our slides and therefore give a better result to our patients. So this requires a little bit of understanding of physics, which I shall try to do in as simple a manner as possible. But before we start, let us look at these beautiful sceneries that are a part of what we see every day. The lovely orange sunset, the twilight, the blue sky. What does this have in common with these scatters that we see on our machine? I'm sure all of you sitting and reporting slides in the hematology laboratory would have seen these various scatter plots that are there in whichever cell counter that you may be using. Any 5-part cell counter from whichever manufacturer will give you a scatter plot that you will understand and that you will learn to interpret. So what do these have in common? The scatter of light. So all of us know that when light passes through a particle, depending upon what is the content of the particle, the light gets scattered in various directions. And what we can see is the color that is most prominent, like the blue sky or the orange sky or the dark sky that we can see in the late evening or night. So, and also the rainbow that you can see. So extend the analogy further. Our cells are particles and they are passing through a liquid medium, and the light, the incident light, hits upon these cells, and therefore the white light, gets scattered based upon the properties of the cells. So that is where the analogy is. So based upon the property of the cells, when the lights get scattered in different directions, they form clusters, and these clusters are recognized by various algorithms and the cells are identified. So, incident light in a neutrophil getting scattered. So you have a high angle scatter or a large angle scatter and a small angle scatter. The laser light upon a flow cell which is getting scattered into a low angle and a high angle. So depending upon the size of the cell, a cell with greater volume, more granularity, there will be more scattering. A cell that is smaller, which has less cellular content, which is less complex, will get scattered to a lesser degree, and therefore they can be differentiated. And this light scatter will be plotted in a two-dimensional scatter diagram. And that is the diagram that we will see on our cell counters. So just to reiterate, when the cells pass through the sensing zone, the light is interrupted and it is scattered. So when the cells pass one by one, that will give you the cell count. When it scatters, the forward scatter based on the cell size and the side scatter based on the cell content and the complexity of the cell, which will include the granules present inside the cell, the nuclear lobularity, and any other staining that you may use. So all this will determine how and where the cell scatters. And like I told you, it will get identified and differentiated based upon the scatter due to the light that falls upon them. Now, these are cells which are unstained. These are cells which are not tagged. Now, if we use fluorochromes and which stain the cellular membrane or the content of the cells and send it in a single stream in a sheath fluid, the laser beam that falls upon them excites the fluorochromes that are there. There is fluorescence that is emitted. This fluorescence is then detected and it is converted into the scatter plots, which we will see. Again, the forward scatter is based on cell size and the side scatter is based on the cellular content. You extend the analogy further. This is what flow cytometry is all about, where you take a sample, you tag it with different monoclonal antibodies which have different fluorochromes that are attached to them, and this is passing in a single stream or a single file enclosed in this sheath fluid. So you have a fluidic system in which the cells are passing. You have an optical system where the cells get scattered, pass through various filters and are detected using respective detectors or identified detectors. Once these are detected, then there is an amplification of the various signals that you get from the cells that have emitted this light. This is converted, the analog is converted to a digital medium and it is sent to the computer. So you have a fluidic system, an optical system and an electronic system. And this is what we are using in most of our cell counters for our differential counts. So we may not be tagging them with fluorochromes, but we definitely, finding out how they scatter based upon their cell size and the cellular content. If we use different fluorochromes, like some manufacturers do, then it will emit the particular wavelength of light, and that will be detected by specific detectors, and these detectors will in turn amplify and convert it into a digital uh, picture that you can see or a scatter plot that you can see on the screen, and hence the cells can be identified. So this is how you get your various scatter plots from various cell manufacturers or various cell counters that we are using in our lab. Now, while we're thinking about the optical scatter, while we're understanding the optical scatter, we should always remember and we should not forget that we started out cell counters with the impedance technology. And this was what was propounded by Sir Wallace Coulter, and that is the basis of the Coulter principle that is still employed in many cell counters even to this day, probably with a little modifications to help improve the results that we can get. So what happens here? This is a very simple principle. There is an internal electrode, there is an external electrode, and you have an electrolyte solution. Particles are passing through this, and the cells will only pass in one direction, and there is a sweep flow that ensures that these cells don't go back again here. And as the cells pass, you know that this is an electrolyte solution, so there is electricity that is passing. And when the cell passes, there is a momentary reduction in the conductivity. Now that causes a change in the conductance, and the number and a pulse is generated. So the number of pulses that are generated will be equal to the number of cells that are present or that have passed through the sensing zone, and the amplitude or the height of the pulse will give you the volume of the cell. So this is a very basic principle of impedance that is used in our cell counters, through which we understand the number of cells that are present, the volume of cells that is there, and even based on this, the cells can be classified based upon the volume of the cell, though when you look at both the content and the volume, the classification of cells is always better than just looking at the size of the cells, because as all of us know, the cells may be small or large depending upon the pathology that is present, and therefore the size of the cell alone cannot be used for classification. So based upon the pulses that are generated to impedance, you will get a, a WBC histogram, you will get an RBC histogram, and you can get a platelet histogram, because all we're doing is counting the number and measuring the volume. So this is a one-dimensional graphic representation of the cell number on one axis and the cell size on the other axis. So the height of this will tell you how many cells are there, and this, based upon the size, you will determine or you will classify what kind of cell this is. All of us who have used three-part cell counters will know this very familiar histogram, which is the WBC differentiation. This is your RBC. So the RBC differentiation, the RBC and platelet is usually one histogram, where first the platelets are counted since they are smaller than the RBCs, and then the red cells. So the differentiation in the number and in the height determines the cells on the histogram. So this is a one-dimensional graphic representation of cell number on the y-axis and the cell size on the x-axis. These are the scatter plots that you can see on cell counters. So this is your WBC scatter plot, and instead of using a fluorochrome, we are using myeloperoxidase to stain the cells. And as you all know, myeloperoxidase stains the myeloid cells, where the eosinophils stain more than the neutrophils, and the neutrophils stain more than the monocytes. So based upon the size of the cell, which is plotted, and the absorbance of the cell, you will get a scatter plot where you'll get eosinophils, neutrophils, monocytes, and so on. So this is based on myeloperoxidase staining of the cells or the WBCs in the sample that is fed into the cell counter. This is an optic scatter to determine the basophil count and also the total WBC count. So based on this scatter, you'll know that these are the basophils that are present. Now, this is a platelet scatter where the cell size is plotted against the refractive index, and the refractive index of a platelet is between 1.35 and 1.4, and therefore the cells are scattered using the incident light that falls upon them, and whatever is in that refractive index and in the size that is specific for a platelet, you get a scatter. So you will be able to differentiate it from the red cells, which have a higher refractive index, and the platelets, which have a lower refractive index. This is a cytogram which is derived, and this is for the red cells. So this gives you a lot of information. This is an RBC scatter. This is a reticulocyte scatter. So you can see that today's cell counters, because of the optical technology that they're using, give you so much of information about each and every cell type that is present in the sample. Now, don't you think that this is definitely more informative than just a series of numbers that we get on our report? Further scatter plots. This is from your Sysmex, where you have the various WBCs. You have the histograms for the RBC, histogram for the platelet. This is the normal scatter plot where the different cells can be identified. This is again a scatter which is found even in low-end cell counters. So a baso scatter, a differential or the other WBC scatter. This is your RBC histogram and this is your platelet histogram. So you can see these scatter plots in almost every cell counter that is present in a laboratory, and it is only our interest that we have to go and look at these to understand them and to find out how we can interpret them. This is the erythrogram that I was speaking to you. This is the normocytic, normochromic red cell that we find, which is present in all normal samples. And if this particular erythrogram changes its shape, its size, and the way it is scattered, then you will be able to find out the type of red cells that can be present. It gives you more information than these histograms, which are RBC volume or hemoglobin concentration. So based upon the size of the cell versus the hemoglobin content of the cell, you will have microcytes, you will have hyperchromic cells, you will have macrocytes, and therefore a look at the scatter will be able to tell you what kind of anemia or what kind of red cells are present in the sample that has been processed on the cell counter. This definitely gives more information than looking at the RBC histogram and more information than just looking at an MCV or an MCH on our report. These are again the WBC scatter plots. This is a normal scatter plot where eosinophils, the neutrophils, monocytes, the NRBCs, lymphocytes, blasts and large lymphoid cells are present over here, and similarly on the basophil scatter where you have, this is the cell size versus the absorbance of light based upon the staining by peroxidase, and here it is the cell size which is plotted against the nuclear shape and density, or rather the complexity of the nucleus or the lobularity of the nucleus. So you can use any parameter, any two parameters, and plot them to get a scatter plot. And this is what is done in the software that is present in the cell counters that are used in a hematology laboratory. This is again, like I told you, the platelet scatter plot where the volume of the cell is plotted against the refractive index. So the large sized platelets or the large platelets or the giant platelets will be found here, and the normal sized platelets which have a normal refractive index between 1.35 and 1.4 are present within the boundary of this. These are red cells which have a larger which have a larger volume or larger size, but a different refractive index. Therefore, you can, in this scatter of volume versus refractive index, which is a two-dimensional measurement of optical scatter, you will be able to definitely differentiate between a platelet and a red cell. So this gives you so much information, and it categorically tells you how many platelets these are that are there in the sample. This was just an introduction to tell you that there are so many pictures and there is so much to learn in this field of cell cytometry. So much of information that is given by our cell counters that is present in all our laboratories. I want you to join me on this journey where we discover the joy of scattergrams, cytograms, and histograms and use them in interpretation of the hematology samples that are processed in our labs, the interpretation of our complete blood counts. We shall look at individual examples, we shall look at cases in subsequent videos. And thank you all for this patient hearing. And if you want to get notifications, if you like this, please subscribe to my channel and join me on this discovery as we go forward. Thank you and good day.